Welcome into a new episode of the Bengals Beat Podcast. I'm your host, Kelsey Conway, here with a breaking news edition of this podcast. And today there's a lot to talk about with the Bengals, and it all starts with Joe Burrow. Yesterday, he suffered a toe injury that we just found out is going to keep him out for a minimum of 3 months. Joe suffered what is called turf toe in the second quarters of yesterday's game. He was unable to return to the game. After the game in the locker room, I saw him with crutches and a walking boot, and reports last night surfaced that the Bengals feared it was a very serious toe injury, and it turns out that he is going to need surgery, and that surgery could keep him sidelined for a minimum of 3 months. It could be longer, but we at least know it is going to be a while before Burrow is able to play again, if he is able to come back this season. We'll have a chance to talk to Zach Taylor later this afternoon, and we'll have updates from Cincinnati's head coach. But right now, to get more information about this injury and just how unique and hard it could be for Joe to come back from, we have a special conversation with Dr. Andrew Miller, who is a foot and ankle specialist, an orthopedic surgeon who is also the Reds team doctor for feet injuries. So we are lucky that he's going to be able to give us some more information on this injury and exactly what to expect. So here's my conversation with Dr. Miller. Dr. Miller, thanks so much for joining me. There's so much talk and questions right now about turf toe, so I couldn't think of someone better to come on and give us all the answers we're looking for about this specific injury. So thanks so much for joining us.
Of course. Thanks for having me.
Okay, so while it seems like a pretty basic question, majority of the questions that I've gotten is, and we'll start with this being simple, what exactly is turf toe?
Yeah, turf toe, more aptly named because of the turf. That's the most common way people injure this. And so what happens is there's usually a load or an axial amount of force that pushes the foot into the ground and causes the toe to extend beyond what it's normally supposed to do. And that disrupts the ligament or the soft tissue that holds the toe together on the bottom of the foot.
So for those that have never had this injury, how traumatic would you say it is? And we'll get into the severity of Joe's injury and what we've learned about what happened to Joe Burrow yesterday. But can you just explain just how challenging this injury might be and why it's so unique and tricky right now for everyone to kind of predict Joe Burrow's timeline to return?
So initially, it does depend on the grade, as you mentioned. In other words, grade is what we judge the severity of the injury by. So more mild injuries, you're going to treat it non-surgically and so forth. But really the crux of it is that you of course, walk on the bottom of your foot. So even walking, let alone running down the field away from a linebacker, is going to be a lot of stress applied to this one area. And these are very small soft tissue pieces in the area of that body. So millimeters we're talking about of soft tissue, and that allows the foot to function appropriately, but it needs to be very well integrity wise healed before he can undergo such high level of activity again.
So what is the difference between if he were to break his toe compared to turf toe, where reports have said that Joe tore ligaments in his toe, and that's what's made this so challenging?
Yeah, so a ligament is a bone-to-bone attachment. So bones are held together by soft tissue, and we call those soft tissue pieces ligaments. If he had simply broken the bone, the toe itself, that would have been a much more simple injury and more likely a shorter duration of being out for the Bengals. So once you injure the soft tissue, because now we're talking about the motion, the way the joints move together, and if they don't move correctly, then he creates chronic pain, potentially wear and tear down the road, and really for us in the short term, the inability to do what he needs to do. Those injuries are much more complex and challenging when they become a high grade or severe injury.
So in Joe's case, I don't know if you saw the game and when he went down, but it was a contact related injury. He was trying to escape pressure from the Jaguars offensive line, was trying to climb in the pocket, and he just went down. So how you were explaining it to me, how the injury happens, if you had to guess, can you break down what you think happened with his toe there?
So he was probably, if this is the ground, he was probably stepping down on the ground like this, and then somebody came from behind and forced the foot in an awkward position where the toe went way higher than what it was supposed to. And the bottom tissue got stretched underneath that foot to the point where it tore. And that would be what the turf toe refers to. That's what we're all assuming happened.
So would you, if you were evaluating Joe yesterday, would you have been able to diagnose turf toe right away? Is it something that's pretty simple for doctors to know?
Yes and no. You have a pretty good idea of what happens. You can assess the stability of the toe based upon some exam findings, but there's also other structures down there that could have been concurrently injured. So to really get a good diagnosis, you need x-rays and an MRI.
For the general public, it wouldn't be uncommon for people that have never suffered this injury to look at it and say, he's going to miss 3 months for a toe injury. Can you explain just how painful and challenging of an injury this is for someone to deal with?
Yeah, I mean, it's extremely painful from the standpoint you could be standing there and that would be fine. But to really ask the foot to function, not just walking, we're talking about pushing off even from either landing on his, I think it's his left foot. So landing
Yes.
on that foot after throwing a ball and having the stability to where you're actually using the big toe instead of shifting your weight to the other side of the foot. All these elements come into play. And so when you're experiencing pain, the body's naturally going to deviate away from that pain generator. And that's going to lead to other issues and his inability to play in its current state, assuming it is that high grade injury.
Reports have said it's a grade 3 turf toe injury, including torn ligaments. The reports also have said it's a minimum of 3 months. What would you expect the timeline to be?
Yeah, I mean, from those reports, grade 3, I mean, that timeline coincides with that. So grade 3 means that the ligament, that soft tissue we were talking about on the bottom, has completely torn away from the bone portion of the toe that we're concerned about. And so there's displacement of some of that bone piece on the bottom, and the ligament is not functional. And we worry that if we left it that way and did not do surgery, then it may not even come close to approximating back and healing the way it needs to heal. So if you look at the reports and protocol on how you would treat this non-surgically and surgically, surgery is typically the way to go when you have a high-grade injury, because now you're worried about the soft tissue even being able to heal back appropriately. And that timeline is appropriate. They're not going to let him really get out of a boot for the first several weeks. That'll follow by walking and motion and strengthening. And so if you look at all that, how it extrapolates to a time frame to be able to run again, 3 months bare minimum seems reasonable.
Is there any scenario in which an injury like this could take longer than 3 months?
Yeah, no, it could take longer. It depends on the person, depends on where the soft tissue tore, how they repair it, concurrent injury around that area. So it's not a one-to-one, all turf toes are created equal. But I'd say 3 months is a nice ballpark number to which to start from.
Can you walk us through the process of what you do in surgery in terms of what you're looking to fix in surgery, and then what step 1, 2, and 3 after the surgery takes place?
Yeah, so if you think about, just to give you some perspective, let's say looking at your knee, you have your kneecap on your knee, right?
Mm-hmm.
There, that is a bone. It's called a sesamoid bone or an extra bone. There are 2 of those bones, like your kneecap, underneath the big toe. So this soft tissue ligament attaches to those extra bones. And what we find in these injuries is that the ligament peels off or tears off that extra bone, that sesamoid bone. So when you're going in underneath the toe, what you want to do is assess exactly where that tear is and then be able to repair it. Sometimes that means that you are literally sewing it back together if the soft tissue was torn in the middle. A lot of times, though, it will peel off or avulse off the bone directly. And then in those cases, what you have to do is apply a small little anchor or device to be able to bring the soft tissue back to the bone and then allow it to stay there stably for recovery.
So he'll go through the surgery. We don't know when he's going to get that procedure done, but how long would you say he's going to be completely immobile?
Well, I mean, usually from a perspective of wound healing, he'll be out where he's not doing much at all for a week or two. And then once the wound heals appropriately, then they're going to want to start doing some gentle motion. Therapy will be a big part of this. Any small joint, whether it's in the hand or the foot, if you immobilize it enough, it's going to get stiff, right? And we don't want that to happen. Otherwise, he's not going to have the function we need. So this will be heavy induced therapy when the time is right. We usually start walking through the foot a few weeks after the initial weight bearing begins. And then eventually he'll get out of what's called a boot or an orthopedic sandal into something more flexible and allowing him naturally to walk through the foot in a shoe.
I just have a couple more for you. In your experience of evaluating these types of injuries, how much of a fluke would you say this was yesterday, in the fact that they feared it was the worst case scenario, and it turns out that he didn't just get turf toe, he got the worst degree of turf toe?
Yeah, I mean, I feel for the guy. It seems like every time you turn the corner, he's getting the worst of the worst here.
Right.
I mean, the most common in an office are those lesser grades. We are not operating on these all the time. And so to that point, yeah, grade threes, they definitely happen. They're not extremely rare, but I would say that grade one and grade twos are more common than seeing a bunch of grade three severe injuries. So, he definitely had some bad luck, but you also have to think about how aggressive, football is, and the weight of these players, the amount of force that they're playing with. So that plays a part. If we're seeing these injuries at a grade school or a high school level, much better chance that somebody's not going to get to this level.
How long is a turf toe surgery of this magnitude? How many hours?
It totally depends upon the surgeon and their comfortability with it, but it shouldn't, if we're just specifically talking about the turf toe, it should be less than an hour.
But it seems like, without knowledge of, how many ligaments he tore, it seems like it could be one of those things where it's a very tricky surgery, because you have to be very precise.
And it's an area of very small pieces of tissue. I always call these a high rent district. There's a lot going on in a little area, right? So what you're trying to do is be very precise, to your point, about teasing this out, making sure you have the right structures, you have the right fixation, and that all just takes time. You want to be careful with where you're going, of course.
I know you don't do wrists, but it's crazy to think about. As I was talking to you about tearing ligaments, I remember sitting in the same chair talking about him tearing ligaments in his wrist, not too long ago, 2 years ago. So, like you said, it seems like he's getting the worst of the worst. These aren't just broken bones. These are torn ligaments. And that's what is just devastating for probably Joe, his family, and the Bengals. The last question I have for you is, with this whole process of the actual injury taking place and then the recovery timeline he has in front of him, what would you say is usually the most challenging part of the recovery process for patients that you've treated for this injury?
So you're always trying to play both sides. The coach wants them to get back. The family wants them to heal. And really, I'm there sitting, just making sure that all plays together so that we're doing everything as fast as we can, but in as a safe manner as we can. So you're always kind of threading that needle to a point where we can push as fast as we can without doing harm to the surgery and the repair. And so sometimes it's dynamic. Certain people have more confidence or less confidence in their recovery, and you play every one of these differently in terms of the patient themselves. And that means that when it gets time to start strengthening, motion, the amount of degrees even of motion that we allow in therapy, all those are dynamic questions when we evaluate the patient and they come back in the office and say, oh, you're behind what I think you need to be. We need to move farther. You're beyond what I think you need to be. Let's slow it down a bit. And so that's always a dynamic thing that is just done on the fly. And that's why the 3 months, you'd think this would be a hard and fast rule, and it's not. It's a good goal to have, but you can be here or there before or after that time frame.
So is there any chance it could be before?
If it's before, it's not going to be very much. It might be like a week or two, but I think your best shot is going to be, okay, close to 3 months. Could it be longer? Yeah. And I think one thing to think about too is if it is longer, if it goes 3.5, 4 months, it doesn't necessarily mean that there's something wrong. It just means that it's a very difficult injury.
Right. Well, I think the hope for everyone is that Jake Browning can keep the Bengals season alive and Joe could come back in the middle of December and they could make a playoff run with Burrow. But obviously, as you said, there's still a lot that has to happen before you can even start thinking about that. So thank you so much, Dr. Miller, for joining us. This was excellent. I learned so much about turf toe and what to expect from Joe's injury and the rehab ahead of him. So again, thank you so much for your time.
My pleasure, Kelsey. Thank you.
Thank you. So much good stuff there from Dr. Miller. Really fortunate that we were able to have him on this episode today. So like I mentioned at the top, we will have all of the information throughout the week as this continues to unfold, and we will make sure that we keep you updated along the way. Thanks so much for tuning in to this week's episode of the Bengals Beat Podcast. Have a great day.